Hi, my name is Jamin Speer, and I'm excited to tell you about my paper with Adam Osman called Stigma and Take-Up of Labor Market Assistance. Take-up of social programs is often low despite large expected benefits, and this is true in both developed and developing countries. There's a lot of potential reasons for this, including lack of information, costs of applying, and also stigma. But there's little good empirical evidence on stigma, especially disentangling it from these other factors. What is stigma? What do we mean? So generally, it's a psychological disutility associated with participating in a program. There's different types of this. Could be social stigma, meaning I worry about what other people will think of me if I participate. Personal stigma, I worry about how I feel about myself. Also welfare stigma, I worry about participating in a program meant for the poor. We're going to study several of these. We're going to use 3 randomized experiments in Cairo, Egypt. I'm going to tell you about one of those today. I'm going to focus on recruiting for job fair attendance. So what we do is we randomly vary the recruiting pitch to see the impact of take-up on this job fair attendance. We're going to include some stigma treatments to try to dispel stigmas surrounding entry-level jobs. So what we do is door-to-door recruitment for a job fair. The jobs advertised at this fair were entry-level jobs like waiter and cashier. There's a couple of nice things here. One is we know a lot about the people. So we know their work history, their aspirations for jobs, and also socioeconomic status. The outcome we have is attendance, not just signing up. So they actually have to do something. Now, we're going to try to distinguish between making the stigma more salient and actually dispelling it. In our other experiments, we found that just bringing up a stigma had negative impact on take-up, even when trying to dispel it. So we're going to separate those here. The salient stigma treatment brings up the stigma about the entry-level job, but doesn't try to dispel it. The dispelling stigma adds some evidence and testimonials. So we're going to study specifically the impact of social stigma. Our salient stigma treatment goes like this. Although some people might think that these types of jobs might be looked down on in society, it's important to start somewhere. Okay, so we don't really try to dispel it there. In the dispelling stigma treatment, we add evidence and testimonials. These are based on a survey we did of people who've actually been in these jobs. We add some evidence that they are good for your social standing and also a testimonial. Here are our main results. You see in column 1 that both the salient stigma and dispelling stigma have a negative impact. Not significant, but negative, meaning we're not doing a good job of overcoming the stigma. Even bringing it up has a negative effect on take-up. But you notice there's heterogeneity quite a bit in column 2 and 4. So older people do not respond negatively to stigma and maybe even positively in some cases. So we're going to investigate that heterogeneity that we've seen in all of our experiments in the next section. So we came up with 4 hypotheses about what's going on with the heterogeneity. The first one is that maturity reduces the impact of stigma. So the idea is that you maybe care less about what others think of you as you age. And so in this column, we see that we find strong support for that. The impact of stigma is strongest for the youngest people in our sample and weakens considerably as you get older. The second hypothesis we came up with is that those who are higher income or more educated will have higher income, more educated peers, and that's what impacts stigma. So if you have higher educated peers, you're going to feel worse about entry-level jobs. We don't find support for that. The interaction here with your education and with your SES are not significant, basically 0. The third hypothesis is that work experience reduces the impact of the stigma treatment. The idea is that any stigma is already internalized if you have, or overcome if you have taken these jobs before. Whereas if you haven't, maybe the treatment actually adds something. We do find some support for that. The impact of stigma is essentially 0 for people who are currently working, and it's negative for those who are not. Lastly, our last hypothesis is that those with higher career aspirations respond more negatively to stigma because they feel worse about taking an entry-level job. We do not find support for that at all. So in column 5, we put everything together. We find strong support for the first hypothesis about maturity and some support also for the currently working hypothesis. So the implications here are that stigma surrounding entry-level jobs do suppress take-up of assistance programs, job training and other experiments, job fairs here. Just bringing up the stigma has a negative impact, even if you're trying to dispel it. But maturity and work experience do seem to reduce the impact of stigma, whereas aspirations and your peers do not. And what this implies is that stigma and trying to overcome stigma affects not just take-up, but also the composition of who shows up to a program. Last thing, we do look at welfare stigma in a separate experiment. Welfare stigma commonly believed to be important, but there's not a lot of evidence. Using a clean design here, we find no evidence at all that welfare stigma is important. Okay, I hope you'll look at the paper for more details. Thanks, everybody.